The sales of sugar-sweetened beverages have declined in the country since the introduction of the Health Promotion Levy in 2018. Now, these are the findings of a study by the South African Medical Research Council Centre for Health Economics and Decision Science. I'm joined now by Professor Karen Hofman from the Wits School of Public Health, one of the partners in the study. Professor Hofman, thank you so much for joining us this morning. As the foundation of our discussion, give us a quick idea of what is the aim of this study. It included Wits University, UWC here in South Africa, as well as a university abroad. How did you set about this study?
Well, we knew that the tax, the sugary beverage tax, also called the Health Promotion Levy, was introduced in April of 2018. And we consider that very important to follow up to see whether people actually did change their habits around drinking sugary beverages, and the fact is that indeed they did. It was important that we worked with people at UWC who have a lot of experience in nutrition, and we also worked with people at the University of North Carolina who have worked on these kinds of projects to evaluate sugary beverages across the globe, including Mexico, Chile, and 50 other jurisdictions where there is a sugary beverage tax.
Talk to me about the reaction to it. Obviously, the study would have looked at the reaction from the market, from consumers, but also the reaction from the industry itself. How did the industry involved in the production of these beverages, how did they react to the introduction of this tax?
Well, what they did two things. The one was they did pass on the tax to the consumer. So the price of sugary beverages went up. They also, to try and mitigate things for themselves, increased the price of carbonated beverages that had less sugar in them. So they certainly, but they did pass on the tax to the consumer, and which was what we would have expected and hoped for. And then they also did change their volume of the sizes of the sugary beverages that are sold. So the term is reformulated, and they switched the sizes from larger to bigger, and from bigger to larger, from smaller to larger, and from larger to smaller, mainly the other way around, to smaller beverages, so that in theory people would drink less sugar. But the fact is that we don't know whether people drank 250 mils, so they had to buy more of that, or whether they just stuck with their 330 mil arrangements.
So the knock-on from that, obviously, then we look at how your consumer then reacts. Are they buying less of it because it now tastes different, because it doesn't have as much sugar in it, or they're buying less of it because it's more expensive? And I suppose your study also had to look at the reaction from low-income houses versus higher-income households.
Yes, well, the fact is that there was actually, we examined data from about 3,000 households. It's a group that collects data internationally called Kantar. It's an organization. And we looked at things before the tax, when the tax was passed, and a year later. And the fact is that there was a significant reduction in sugar from across the board, across South Africa, but mostly in lower income individuals, and in fact in individuals who drank the most. So there was an associated study that looked, for example, in Langa and Soweto, and found that individuals who were drinking, for example, 10 sugary drinks a week cut down to 4 sugary drinks a week. So the fact is that that was very significant because the sugary beverage tax was designed as a health promotion levy. And in fact, it had that impact on the people who need this, in fact, the most. The most vulnerable people in our population don't have access to fantastic health care. And control of hypertension and diabetes is problematic across the country. And so lower income households, obviously well beyond Soweto, are responding significantly to this tax. And so the health, it is actually a promotion of health that is happening as a result of this tax.
And that can only be a good thing, not the tax itself, as it were. Thank you so much. We're going to leave it there. That's Professor Karen Hofman with the Wits School of Public Health. We thank you so much for your time.